AM 1450, FM 99.3 KNSI. Welcome to another edition of Your Health. Your Health is produced in association and cooperation with the folks at CentraCare. Today's topic, leukemia and lymphoma. One of our guest experts in studio is Janelle Thoreson. She's a core charge nurse with medical oncology at CentraCare, the Coborn Cancer Center, also the Hematology Support Group. September is Leukemia and Lymphoma Awareness Month, which is why we are talking about this. And also in studio with us is Sam Voss, a Paxman Scalp cooling recipient. Ladies, welcome.
Thank you.
Thank you.
It's good to have you in studio today. Janelle, you're going to get the first question. Leukemia. What is leukemia?
Leukemia is a very broad term that basically describes a type of blood cancer that can occur. Under the blanket of leukemia, there are four main types of leukemia, and they're categorized based on how aggressive or how quickly they act in the body, and also what type of cell the leukemia actually affects within the blood. The four main types of leukemia are ALL, or acute lymphoblastic leukemia, AML, or acute myeloid leukemia, CLL, chronic lymphocytic leukemia, and CML, chronic myeloid leukemia.
Are there some people who may be more predisposed to being, more apt to get leukemia or not?
There are certain risk factors, sort of. For most types of leukemia, risk factors and possible causes are not exactly known. Okay. However, for AML, or acute myeloid leukemia, some risk factors include receiving certain types of chemotherapy in the past, having Down syndrome, some genetic disorders beyond Down syndrome, chronic exposure to benzene, which can be found in petroleum products or cigarette smoke,
right,
and radiation exposure. In terms of radiation exposure, that can also put people at risk for ALL and CML. And then that's actually an area that continues to be under study because we don't always know what causes these leukemias.
How common is leukemia at CentraCare? How often do you have to treat this? Is it one of the more common diseases that you take care of at the Coborn Cancer Center?
You know, it's hard to say that because it's not as common, say, as breast cancer or lung cancer, but it is not extremely rare either.
Right. You hear about it in the news a lot, don't you? How do you find leukemia? How does the search begin?
Interestingly, a lot of people with leukemias are found incidentally, especially when it comes to the chronic leukemias, which tend to develop over time versus rapidly now. So some people will go into their doctor for their routine physical and get what's called a complete blood count, which is a very common blood test that kind of tests for things like your hemoglobin and your platelet cells and your infection-fighting cells.
Okay.
They'll have that as part of a routine workup for a primary care provider, and an abnormality will be found in one of those cells, which prompts the need for further attention and workup. Sometimes, in terms of the more acute leukemias, people will start to feel like they're just experiencing more fatigue on a regular basis, or it's harder to do your regular physical activities because you become more short of breath. Maybe I've had a low-grade fever for a long time that just seems to persist and stay there, or I'm developing more infections over time. Those are also things that might prompt a provider to work people up further. Now, granted, it becomes challenging because a lot of those same symptoms are symptoms for many, many other very common diseases that exist as well.
Which is why when you come in for something, you may be diagnosed with the leukemia, correct?
Correct, yes.
All right. Sam, is this sounding familiar to you when she's talking about all of these things regarding leukemia?
I don't have leukemia. I have breast cancer, but I am familiar with all the terms as far as the CBC and your hemoglobin, and because my hemoglobin has been low and I've been fatigued. But my platelets and my red and white blood cell counts are all up. But I can understand how it can be found from those symptoms.
Some commonality.
Yes,
right?
Exactly.
Well, let's switch over to lymphoma and find out what is lymphoma. How does and let's differentiate between leukemia and lymphoma as well.
So lymphoma, also a blood and bone marrow cancer. It's basically differentiated from leukemia based on, again, the type of cell that the cancer affects. And so lymphoma starts with kind of a change to a blood cell called a lymphocyte, which is a type of white blood cell found in the body's immune system. And so what happens is, as with any cancer, the cell is changed and becomes unnaturally dividing.
Okay.
All cells divide, but cancer cells have this way of rapidly dividing that doesn't make sense, and the body has a hard time of controlling that rapidly dividing cell. And what happens in lymphoma is these lymphocyte cells, they rapidly divide and then accumulate in a lymph node in the body and grow into a mass.
All right, and that's where sometimes we'll be examining ourselves, and that lymph node seems to be a little big, and there's even a little pain there. Mm-hmm. Discomfort.
And sometimes lymph nodes actually can enlarge as a result of an infection.
Okay.
And so we have to differentiate between, is this a lymph node that is enlarged because of something else going on in the body, or is this lymph node abnormally enlarged? And interestingly, a lot of times with lymphoma, the lymph nodes are painless, as opposed to with an infection.
All right. If I'm standing there in the shower and I notice, this doesn't feel quite right, I wonder if I should go see my doctor.
I would definitely recommend that.
The answer is yes. Right, exactly. AM 1450, FM 99.3, KNSI. Going to school today with Janelle Thoreson and Sam Voss. Janelle with CentraCare at the Coborn Cancer Center, also with hematology, the support group there. When we return, we're going to talk with Sam regarding the Paxman scalp cooling apparatus. That conversation is next. You're listening to Your Health, AM 1450, FM 99.3, KNSI. AM 1450, FM 99.3, KNSI. Welcome back to Your Health. Today, we're talking with Janelle Thoreson and Sam Voss about leukemia, lymphoma, and, in fact, breast cancer, because the Paxman scalp cooling apparatus is what Sam Voss is an expert with. Hello, Sam.
Hi, good morning. Thanks for having me.
I hope it's okay that I put you in that expert category.
Sure.
All right. Now, you mentioned you are dealing with breast cancer.
Correct.
How does the scalp cooling apparatus work, the Paxman scalp cooler? How did you find out about this? I've never heard of it.
I didn't hear about it before I had breast cancer either. CentraCare's team introduced me to it, explained it to me. To be honest, one of the things that scared our family the most was that I was going to lose my hair. I haven't been super vocal about my breast cancer. I didn't want it to define me. I want to try and be normal as much as possible. I've worked through all my treatments. So keeping my hair was something that I felt would help me feel less sick, less like a victim.
All right. I'm going to ask Janelle just to jump in here, and if you can address what happens if somebody goes on chemotherapy and what happens when hair loss occurs. Why?
Chemotherapy works by targeting all rapidly dividing cells in the body, because that's what cancer is.
Right.
Unfortunately, chemotherapy cannot always distinguish what are the healthy rapidly dividing cells and what are the unhealthy rapidly dividing cells. And hair is the second fastest dividing cell in the body, which is why many chemotherapy drugs cause hair loss.
Okay. Now, what about radiation? Does that also cause hair loss?
It can, yes.
Diagnosis of breast cancer. Did you have the option of one or the other, both, or?
To use or not to use a Paxman? Yes. Absolutely. Yes, it was my choice. Honestly, my doctor yesterday, Dr. Alcati, told me she didn't think it was going to work for me, and she said I proved her wrong. I only lost 30% of my hair, I would say. You do get some shedding. You do lose some. I did. But I was able to cover it, and a lot of people, I come from a small town, didn't even know that I had breast cancer.
Well, tell me about this device. How big is it? What does it look like?
It's like a cooler, what's it called? Ice pack, basically.
Oh, sure.
That you get fit on your head. You actually get fit for it.
Okay.
And then you put a neoprene cap over it, which you get really tight on your head.
Okay.
And then you have it for 30 to 40 minutes before chemo you have it on. It's hooked up to like basically a refrigerant or an air conditioning unit,
Sure.
which cools your head to 68 degrees. And then you keep it on all during chemo, and then you leave it on anywhere from 45 minutes to an hour and a half after chemo. And it's supposed to freeze the chemo from getting to your hair follicles so your hair doesn't fall out.
And apparently it works.
It worked for me.
Very good. Janelle?
In terms of the way that the treatment system works, as Sam talked about, so that cap is fitted to the head in such a way, and that's a very important part of the Paxman scalp cooling system is the fit of the cap. And so you do have to be fitted, and we have trained staff at our center who are able to fit people appropriately for the cap size. And then we really encourage patients to go online to what we call the Paxman Hub. Paxman USA is the company that we work with for this scalp cooling system. And there's actually videos online that really teach patients how to care for their hair, how to fit their cap appropriately, because that is a very big factor in the success of this program is the fit of your cap.
Okay, Sam, the Coborn Cancer Center, the Coborn Healing Center, pretty much juxtapositioned with each other, right? You can't have one without the other anymore,
Right.
Not in St. Cloud.
Exactly.
When you were hearing and finding out more about the Paxman scalp cooling, did you go there to see these videos and all of that, and how did they help you?
They introduced me to it. They fit me for it. They said there was a grant for the Paxman cooling system.
Yeah.
Just correct me if I'm wrong, Janelle. It is about $2,000.
$1,500.
Okay. Mm-hmm. And then they also ran it through my insurance. I qualified for the grant, and all I had to pay out of pocket for this was $250, which I could pay for with my HSA.
Sure.
So we got fit for it. 4 to 5 days later, it arrived at my home in a pack that had the cooling cap. It had a headband, a towel, a water bottle, brush, shampoo and conditioner that you use during the process.
Okay.
And then there's also a pay-for-use token, which is actually scanned every time you go in for chemo onto the Paxman unit itself, so it knows that you're paid for this and it's ready for you to use. So it's just like scans through it. So they know how many uses you have. For example, I had 6 treatments.
Okay. Now, as you're explaining all of this, I'm thinking to myself, golly, not only do you deal with breast cancer, but you get this thing in the mail or UPS or whatever, you strap that baby on at home, so it's okay. You're in the comfort of your own home to do this, right?
Right, exactly. I tried it on and watched the videos the night before my first chemo and tried it on only twice. So, I mean, it's really easy to use. Thankfully, I have a twin sister who came with me to every chemo, and she helped me get it on tight. You have to have your hair really wet before you put it on, but like super tight, like under your chin. It's not uncomfortable. I mean, the tightness is probably the most uncomfortable, but the getting to the 68 degrees really isn't that uncomfortable. Maybe the first 5 minutes.
Okay.
Out of 6 treatments, I had a headache during the second treatment only, which I just took some ibuprofen.
Sure.
But otherwise, I mean, for me, it was worth it. I have a high pain tolerance, but honestly, even someone who doesn't have a high pain tolerance, I think it's something that you can comfortably use while you're sitting there.
Is her story, Janelle, pretty familiar? Are you familiar with the Paxman unit?
I am familiar with the Paxman unit.
Does this sound like the usual regular thing that would be happening?
I think it depends on the person.
Yeah.
We have had a few stories very similar to Sam's, and a few, unfortunately, that people didn't appreciate their experience as much. But I also think that we haven't seen a great utilization of this thus far. It's relatively new in our center, and we're hoping to get the word out, especially with success stories like Sam's, in order to promote this and really encourage people to look into it and use it.
Is this the typical way you would expect people to use the Paxman scalp cooling, by doing it at home, or could they come into the Coborn Healing Center and do it there?
Well, I do want to clarify that whereas things are shipped, like the products are shipped to her home,
Sure.
she would have to bring it to the center to use it. It's
Okay.
not the actual cooling system is not something that can be used at home.
Oh, I see. Okay.
We have a unit within the cancer center, so
That it has to be plugged into?
Yes, that it
Okay.
has to be plugged
Gotcha.
into, and so it started, like she said, about 30 minutes before the treatment, and then the cap is kept on during the duration of treatment, and then between 30 and 90 minutes after the treatment, depending on the thickness of your current hair.
Gotcha. So you cannot do it at home,
Correct.
Unfortunately. But when it came in the mail, you were able to get used to it and try it on in the comfort of your own home.
Exactly.
Very
yes.
good. AM 1450, FM 99.3 KNSI. Our guest, Janelle Thoreson with CentraCare, the Cancer Center, and also Sam Voss, who is a recipient of Paxman Scalp Cooling. Folks, there is much more to come. More questions regarding Paxman, leukemia, and lymphoma. Stay with us. You're listening to Your Health, AM 1450, FM 99.3 KNSI. AM 1450, FM 99.3, KNSI. Welcome back to Your Health, our final installment, talking with Janelle Thoreson and Sam Voss about leukemia, lymphoma, and also this thing called Paxman Scalp Cooling. Janelle, who is eligible to use this? Who does this work for, this Paxman Scalp Cooling?
So this Paxman Scalp Cooling System at this point in time is indicated only for people with solid tumor cancers. So unfortunately, people with leukemia and lymphoma actually cannot use this system right now. And that's just based on the research and the studies that have been done thus far. There are some exceptions to the solid tumor cancers as well. So any interested patient should really review with their healthcare team to determine if they are somebody who's eligible or not based on cancer type and treatments that they're going to receive, because not all chemotherapy treatments have the same potential for hair loss either.
Right. All right. Now, tell me about Hair to Stay. What is Hair to Stay?
Sure. So to talk about Hair to Stay, I'll first touch a little bit more on the financial obligations of the Paxman system. And so Paxman treatments are completely based on the number of treatments the financial aspect of it is based on the number of chemotherapy treatments a person is going to get.
Sure.
The maximum out-of-pocket cost that Paxman says that a person would have would be $2,200.
Okay.
The CentraCare Health Foundation has scholarships available to help offset the cost of some of that.
All right.
I think we had mentioned the $1,500 scholarships that we have available. And so we would definitely encourage patients to inquire about that as well.
Now, I'm just going to jump right in right now and mention the fact that, folks, if you would like to make a donation for cancer patients, it is very simple. Contact the CentraCare Health Foundation, 654-3687. You can go to CentraCare.com. Of course, area code 320-654-3687, or visit CentraCare.com.
And yes, that's very important because all of our scholarships are currently funded by donor dollars.
Donations,
so,
right.
We appreciate that very much. In addition to the scholarships that we have available, obviously there's some people that would still have additional out-of-pocket costs because, like I said, the cap is $2,200 from Paxman. And so there is an organization called Hair to Stay, which is a nonprofit organization that the Paxman company can help you apply to help with further financial burden.
Are there other options that would be similar to the Paxman Scalp Cooling System?
If somebody's not interested in scalp cooling, but still would like an option for finding something that would be like a hair covering or a wig, we do have an enhancement program offered through the Coborn Cancer Center, and it's offered in the Coborn Healing Center. It is completely staffed by volunteer beauty professionals who provide patients being treated at the cancer center with a wig, hats, and accessories at no charge.
All right. Now, Sam, you would recommend Paxman, would you not?
I would definitely recommend it.
It worked well for you.
It worked well for me. Like I said, I'm from a small town, and some people that have known me forever didn't even know that I had breast cancer.
That's awesome. That's very, very cool. Now, is she 1 in a million, 1 in 20, 1 in 5 that can use and finds it beneficial, the Paxman scalp cooling system?
I think she's one in many.
Yeah.
I don't have exact numbers off the top of my head, but my hope would be that people hearing this segment will start inquiring about this. And we do encourage people that if you're interested in the Paxman scalp cooling, reach out to your healthcare team sooner rather than later, because we really want this to get in place before you start any treatment to minimize that amount of hair loss.
Men as well as women?
Men as well.
Okay. Do men, does it affect men as much if they lose their hair as it does women?
I guess it depends on
the person, right?
The person, absolutely. Yeah. I would never say that men don't have as much of an emotional attachment to their hair as women. But yes, it's largely dependent on the person.
All right. Ladies, thank you so much for sharing the story, Sam.
Yes, thank you.
That's incredible stuff right there. And for, again, taking us to school, I had not heard of the Paxman scalp cooling system before. But again, if people want more information, the best thing to do, reach out to their healthcare professional.
Absolutely, yes.
AM 1450, FM 99.3, KNSI. You have been listening to Your Health.